ABC 10 News at 11 starts now.
California is now mandating COVID-19 vaccines for all healthcare workers. A previous order allowed those not vaccinated to opt for weekly COVID tests instead. Good evening. Thank you for joining us. I'm Kimberly Hunt. Steve Atkinson has the night off. As our ABC 10 News reporter Laura Acevedo shows us, the legal experts say this move is not surprising.
California is the first state in the country to require full vaccination for all healthcare workers. The only exemptions are for religious or medical reasons. Healthcare workers in the entire state will have to be fully vaccinated by the end of September. California's public health officers citing the rise of Delta variant cases, saying it's important to protect patients and those caring for them. Last month, Governor Newsom said healthcare workers would either have to be vaccinated or submit to weekly testing. The new order gives workers no choice. The order also requires all hospital visitors to be vaccinated or have a negative COVID-19 test within 3 days of their visit.
Either to try to persuade your employer to make an exception for you, or to work somewhere else.
Legal analyst Dan Eaton says employers do legally have the right to make these requirements.
In other words, go ahead and don't get vaccinated if that is your choice. But understand that if your employer insists on its employees getting vaccinated, you're going to have to work somewhere else.
Healthcare worker unions across the state, including the California Nurses Association and United Healthcare Workers West, both agreed with the state's move, continuing to ask for things like necessary PPE, appropriate staffing levels, contact tracing, and asking for hero pay. Just days ago, Kaiser, one of the largest healthcare providers, mandated vaccines for its employees, also citing growing concerns about the Delta variant.
That combination really compelled us to take a stand and say, we want to be able to model what we want others to do.
Those that want to be exempt for medical reasons must provide their employer with a written statement signed by a physician. Laura Acevedo, ABC 10 News.
Thank you, Laura. The county reported another 1,100 cases today, while our most recent test positivity rate stood at 7.7%. One more San Diegan lost their life to the virus. And more than 90% of the COVID cases here in San Diego are among the unvaccinated, but the number of cases among the fully vaccinated is rising. Suzanne Hoyam and her husband were both vaccinated in April, but after recently feeling under the weather and lightheaded, they decided to get a COVID test. It came back positive, and her husband caught the virus as well. Fortunately, their symptoms were mild and they didn't need medical attention.
I really feel grateful that I'm vaccinated. I'm so grateful that my symptoms are minimal. Like, I really do feel like the only reason why I'm, walking and talking and standing here is because I'm vaccinated.
And medical experts say cases such as Hoyam's show that despite infection, the vaccines are working to protect against death and hospitalizations. There have been nearly 3,000 so-called breakthrough cases here in San Diego. Moderna says its COVID-19 vaccine is 93% effective 6 months after the second shot. This makes Moderna's vaccine more effective than Pfizer's, which wanes in efficacy every 2 months. Still, Moderna warns there are concerns about breakthrough infections involving the Delta variant, and it says a booster will be necessary as the winter season approaches and antibodies wane. The CDC is not recommending boosters at this time. And Palm Springs is now requiring people to show proof of vaccination or a negative COVID test to eat indoors at bars and restaurants. And the same holds true for large-scale ticketed events there. The Palm Springs City Council passed the new rules unanimously, along with an indoor mask mandate for all businesses. COVID cases in children jumped more than 80% last week. The news comes as schools head back to in-person learning. ABC 10 News reporter Adam Rakusin looks at what the case surge could mean for schools in San Diego.
Across San Diego County, students are either back in school or just weeks away from returning to in-person learning. That return coming on the heels of rising COVID-19 cases in kids across the country.
We're seeing increased cases, we're seeing increased spread.
According to the American Academy of Pediatrics, after declining in early summer, child cases have steadily increased in July. The AAP saying almost 72,000 cases were added the past week, a substantial increase from the prior week when about 39,000 cases were reported. Local numbers show an increase of cases for people under the age of 18. Dr. Mark Sawyer is a pediatric infectious disease specialist at Rady Children's Hospital.
We will see some kids who get COVID in school. I think that's inevitable, but I think the number can be cut down if kids all wear masks.
The Sweetwater Union High School District went back to school last month. According to the district's reopening dashboard, out of the more than 35,000 students enrolled in in-person classes, 90 have tested positive in July and August.
Of course, we're very concerned about all of our students and for our younger students who were not yet protected through a vaccine.
Richard Barrera is the board president for the San Diego Unified School District. They head back at the end of the month and are expecting more than 90% of students to be on campus.
Most importantly for parents, it will be safe for your students to be back on our campuses.
Barrera says the district will lean on the mitigation strategies they've already implemented, plus some new ones, including testing and vaccinations.
Everybody will be wearing masks. Everybody will be tested on a regular basis. Our classrooms are properly ventilated, which is an incredibly important way to combat the virus.
Adam Rakusin, ABC 10 News.
Dr. Sawyer says that they have seen other respiratory viruses this summer in addition to COVID. He says if your child is showing symptoms and you don't know the cause, get a COVID test to make sure. The raging wildfire sweeping through a northern California mountain town is now the 6th largest in state history. The 3-week-old Dixie Fire gained strength last night as it tore through the historic town of Greenville. The fire, which has burned more than 500 square miles, has already burned dozens of homes. CAL FIRE crews from San Diego are helping battle the flames.
So as soon as they get to the Dixie Fire, they're assigned a division and they're immediately engaged in either suppression activities, home defense, any of the assignments that they're typically given, but on a larger scale.
The crews sent up north are being replaced in San Diego County just in case a big fire erupts down here.
In my book, he is the definition of a true American hero.
People around San Diego and all across the country are mourning the passing of Stu Headley, one of the last survivors of Pearl Harbor. And we told you last night about Headley's death from the coronavirus at age 99. ABC 10 News reporter Jeff Lasky spoke with people who knew him about his mission to keep the memory of those who died in World War II alive.
When Stu Headley was in a room or walking the flight deck at the USS Midway Museum, you knew it.
His signature greeting, was aloha, very loudly. I mean, people loved it.
You couldn't help but notice his clothes, the white pants, Hawaiian shirt, the patches from his work with military organizations, and his cap, which let you know where he'd been.
He was sort of a one-man wrecking crew of ensuring that all over this country, people never forgot Pearl Harbor and the courage that the men that served with him had during that fateful day.
Headley was a gunner on the battleship USS West Virginia. Seeing his friends dying all around him and nearly hit himself multiple times, he managed to survive by swimming to shore. He continued to serve through the Pacific Theater's biggest naval battles and didn't retire until 1960. It took him decades to begin sharing his experiences, but once he did, it became his new passion.
And it didn't matter whether you were somebody his own age or you were a 5-year-old kid. He wanted to tell you about it, but he did it in such a wonderful way.
Stu was very inspiring. He was on such a mission to visit school groups and youth groups.
Stu shared his story with ABC 10 News viewers many times over the years, including a visit to his Claremont home, where a group of Navy sailors had volunteered to help fix up his house.
Doing a great job, fellas.
And of course, at his many trips to memorials and ceremonies on the Midway.
To me, it's an honor, because I realize that we're living in a day when they don't get it in history books.
Stu Headley became a living history book, generously sharing that history with all of San Diego.
He was small in stature, in physical stature. He was only 5'2" tall, but I've never come across more of a giant of a man than I have in Stu Headley.
Now that he's gone, it's up to the rest of us to continue his mission so that no one will forget what Americans like Stu Headley did for their country.
Thank you for your service. You bet.
Jeff Lasky, ABC 10 News.
Generous and gentle hero. We will never forget him. The Sheriff's Department is releasing body camera video showing what happened after a deputy was exposed to fentanyl on the job. Some viewers may find this footage disturbing. Deputy Five Eye found a white substance that he suspected was drugs in this red Jeep. And within seconds of touching the fentanyl, the deputy stiffened, fell over, and convulsed.
My lungs just locked up. I couldn't breathe.
Came down to him, grabbed him, and I did one nasal spray in one nostril, opened the other one, another nasal spray.
And that kept Five Eye alive, but he OD'd again while in the ambulance. He survived partly thanks to the Narcan used by his fellow deputy. The DEA says fentanyl is 80 to 100 times stronger than morphine. We have a link to the full video on the homepage on 10news.com.